My name is Matthew and this is my wound care skill video. I've already introduced myself to my patient and I confirmed their identity, and I also performed hand hygiene and put on my gloves. Right now we're in a private room, so I provided privacy for the patient. And lastly, I explained the procedure to her and she did understand. The first step to this is going to be removing her dressing and disposing of it in the right bag, which is in here. And I'm going to open this, not contaminating any of the sterile contents. And when taking this off, I'll make sure to roll the bandage inwards towards the wound. And then I'll pull the dressing up away from the patient so they don't have to see the inside. At this point, I'd assess the drainage on it and I'd dispose of it. And then I'd do the same with the gauze. At this point, I will take off my clean gloves and I'll switch into my sterile ones. Not before I perform hand hygiene though. Okay, now I'm going to arrange the contents of the kit. Making sure to keep everything within the 1-inch border on the outside. Okay, at this point I'm going to clean the wound with my iodine swab sticks. I'm going to do the stitched up wound first going down the middle. And then I'll throw that away, replacing it with a new one. And I'll go down the side, throwing that away, replacing it with a new one. Going down that side, throwing away, replacing with a new one. Go on the very outside, throwing it away, replacing it with a new one. And then lastly, I'll do the outside. Okay. Now that I'm done with the incision, I will move on to the stab wound. And I'll do this in the same way except I'll be working away from the incision. So first down the middle, throw it away, replace it with a new one. Down the side, throw it away, replace it with a new one. Down the other side, throw it away, replace it with a new one. Down the very outside, throw that one away, replace it with a new one. And finally, on the outside edge. And I made sure not to cross over any of the wounds with my swab stick while doing that. Okay, at this point, I would dry around the wound and make sure it's ready before I put on the 4x4 gauze pads. And I'll apply my first one to the stab wound. Dropping it. I want to make sure that my stab wound and incision gauze pads don't touch. Okay, after I make sure those aren't touching, I'm good to put on the dressing. And I'll pinch that in the middle, making sure the blue line is up. And I will drop it right on top, like that. At this point, I'm ready to tape it down. And it looks like I've got a little bit of gauze peeking out on that side, so I would just pick it up and adjust it over, making sure it's all covered. Okay, at this point I would get on another piece of tape, sign it, initial it, put the date, and I'd place it on there, marking it. I would dispose of the contents of that red bag appropriately, and I'd take off my gloves and perform hand hygiene and make sure my patient is in the lowest position possible and has their call light handy. All right. This was Matthew, and this is my wound care video.